good afternoon, and welcome to our weekly COVID-19 Public Health Update with Montgomery County Executive Mark Elridge. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government. Good afternoon and welcome. And joining us today is Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Also joining us today is Adriana Hutchberg, who is a Climate Change Officer and Acting Director for the Department of Environmental Protection. And as a guest today also, Maryland Senator Paul Pinsky. Thank you, reporters and members of the media, for joining us today. With that, I toss it to you, Mr. County Executive, and I believe Adriana is here for the Q&A portion of this presentation. Welcome, everybody.
So, good afternoon, everyone, and thank you for joining us again today. I'll start by talking about something special this week. Friday will be the 52nd celebration of Earth Day, and we have significant news this week in our efforts to combat climate change. Yesterday, the County Council passed the Building Energy Performance Standards, or BEPS, as you're probably used to hearing us refer to it. And I'm really looking forward to signing it into law and implementing it. I want to thank Council President Gabe Albornoz for bringing this bill to the vote and the entire council for their unanimous support. When I submitted this legislation to the County Council last April, we were among the first local jurisdictions in this nation to embark on this type of legislation. I want to acknowledge our Department of Environmental Protection, led by Acting Director and Climate Change Officer Adriana Hutchberg, who is on our briefing today, for developing the thoughtful approach to this legislation and their perseverance throughout this process. I will be working closely to engage with our building owners to educate them on these new requirements, and we have expanded programming such as commercial PACE financing, and we've allocated funding for our building owners and developers to upgrade and retrofit their buildings. As you know, I talked about when this was being introduced, there is no way to the county's climate goals without BEPS. You cannot leave out the built environment, the buildings that are existing today, and think you're going to achieve zero by 2035 or 2045 or 2050 if you do not deal with the built environment. And this legislation was a critical piece of what we need. We have the International Green Building Code, which is addressing new construction, and this gives us the piece we need to deal with existing buildings. So I'm very excited about this. It doesn't mean that it's going to be easy, but it does mean that we have a critical piece in place now with some funding support, but I'm sure we're going to need more. But we have the pieces in place to achieve our goals. I want to look at this greenhouse gas trends chart. Now, this comes from the Council of Governments, and they've not provided us the 2020 numbers yet. And we're going to look at what we can do to create our own path to speeding this up. But those numbers are supposed to come out in by the end of the year. And basically what this shows you is, there's not been a lot of change after the first year in the residential energy. Commercial energy usage has come down, and transportation and mobile sources has also come down a little bit. I will say that I have a lot of confidence in our ability to manage the residential energy, because I think we're going to find it getting easier and easier for installing solar. And in the transportation sector, I'm pretty confident that, like on our own work here, our bus fleets and our vehicles fleets are going to transform themselves to electric fleets with some hydrogen rather than being based on fossil fuels. And what's happening in Montgomery County is going to be reflective of what happens across the country and across the world. So I think transportation is on a self-correcting path that'll help us achieve climate goals, but buildings are a big issue, residential and commercial, and then the general production of energy, where we get our energy from in the grid, whether it's from green sources or whether it's from fossil fuel plants. That is the big drag on the ability to change this faster. And that's just an area we're going to need to put increasing pressure on the energy companies to green their energy sources before 2045. And it would be nice if they get in line with the county's goal of 2035. As I said before, BEPS is critical. And from 2005 to 2018, Montgomery County was able to reduce its emissions by 19%. The United States reduced emissions by 12%. That gives you an idea of where we stack up, in here versus the rest of the country. As we continue to make progress on the goals and priorities of the climate plan, we're continuing to engage and educate our community and our residents on how they can reduce their carbon footprint. This Saturday, the county will hold its 7th annual Green Fest. Green Fest is returning as an in-person event this weekend at Brookside Gardens in Wheaton. And Green Fest gives residents, businesses, and nonprofits and visitors an opportunity to share ideas, learn together, and have fun. And the weather should be nice, so I engage people to come out and join us on Saturday. I will definitely be making my rounds. I want to thank Senator Paul Pinsky from Prince George's County for joining us today. Senator Pinsky chairs the Education, Health, and Environmental Affairs Committee, and he represents District 22 in Prince George's County since 1994. And I've known him for decades, and he is one of the state's foremost progressive leaders. He's been on the right side of pretty much everything. And I'm really happy that he's joining us today. And I wanted to congratulate and thank him for his work this session, along with his colleagues on the Senate and the House for their extraordinary work on the Climate Solutions Now Act. I was proud to testify in front of the Senators Committee in support of this important legislation. The League of Conservation Voters called this legislation the most significant action on climate we've seen anywhere in the country in 2022. And that's quite a statement. I also want to acknowledge the work and advocacy of Montgomery County Senate and House delegation on this legislation. I want to specifically recognize the work of our Senate delegation chair, Senator Kramer, Senator Feldman, and Senator Kagan, who's the vice chair of the Education, Health, and Environmental Affairs Committee. And I want to thank the House delegation, Delegate Barve, who's the chair of the House Environment and Transportation Committee, as well as delegates Lord Charkoudian, Jared Solomon, David Fraser, Hildago, Sarah Love, Lily Chi, and basically the rest of the delegation, which was supportive of these actions. So thank you all for what you did. And now let's take a minute to hear from Senator Pinsky.
Thank you, Mr. County Executive. As you said, we go back a long way. So thank you, Mark. I also want to thank you and the council for the action you took yesterday in passing this very monumental legislation, taking it upon yourselves to do it. Governmental bodies, whether at the federal level with Congress, at the state level, or even at the local level, these kind of legislatures can either tail the populace or lead the populace. And far too many times on the national level and the state level, they've tailed the populace. It's only years after the public has made known what they believe that they follow through with the action. So I have to tell you that the action taken yesterday really shows leadership, that it really shows leading the populace rather than just waiting, putting fingers in the wind to see which way it blows. So I want to applaud the council and you, Mr. County Executive, which I guess is a good segue. After a couple of years, we were able to pass the Climate Solutions Now Act. It's not perfect, but it moves Maryland, I think, in the top 2 or 3 or 4 states in the country in terms of laying out a blueprint for how we proceed. Among the items in the law, it says we are required to reduce our emissions by 60% by 2031, to be carbon net neutral by 2045. And as you said, they will be heavy lifts. The low-hanging fruit is over. We've done the easy stuff. Now it's going to mean some major changes. The bill also puts all of our actions under a fine microscope and uses the lens of environmental justice. For far too long, communities that have disproportionately been affected by climate change have been left behind. So throughout our bill, we set very goals, very clear charges, and actually new investment in our poor communities, in many cases, our Black and brown communities. So that was part and parcel of this legislation. We do require all large buildings to reduce emissions by 20% by 2030 and to be net zero by 2040. And that'll be based on a baseline of 2025. So the next couple of years, we'll be developing that baseline. You know, the bill originally started with calling for full electrification of future construction. That didn't make it. The utilities, BG&E, Pepco, Washington Gas opposed it, I think with a lot of false information. And I think they were more concerned with their profit margin than they were with the environment and the public safety and public health. But there is a study called for to assure the public that we do have the capacity, and the intent of the Maryland legislature is to move towards full electrification. We want to turn over school bus fleets. When school buses reach their life cycle, replace them with electric vehicles. The federal infrastructure bill has money to do just that. We call for the state vehicle fleet to be replaced with zero emissions vehicles. You know, the state should lead by example. It's got the resources, and I think any government should lead by example. So we try to do just that in the bill. We create a green bank offering $15 million to leverage private investment for clean technology. We created an urban climate corps to put young people in those disproportionately affected communities to work for at least a year to help those communities, planting trees, working on energy efficiency, getting their hands dirty, assuring them of $15 an hour, high school, college graduates, whatever, to work for a year in those communities. And hopefully we'll hire people from those communities who feel invested in that work. We've set tax exemptions for community solar projects in low and moderate income communities. We require the state buildings and procurement to reach 75% of their energy being low or no, or full clean energy or low energy. And we also set up a just transition workforce. You know, one thing that's going to happen is it's going to change the dynamic of our society. You know, we don't want to put people out of work who rely on that work, whether it's laying pipe, for their income to pay for their rent or their mortgage or their college tuition. So we've got to have a full conversation with all the stakeholders, government, private sector, unions, to say, how are we going to make this transition? You just can't have someone who's making $85,000 a year be out of work and maybe be retrained for a year, year and a half, and then make $45,000. It might need state assistance, but we need a thoughtful conversation. So the legislation also calls for a just transition workforce. So it's an omnibus bill. Many people suggested we break it into 6 or 8 or 10 different parts. And I had to say, I objected to that. I think we had to have legislation that made people take a choice. They're either going to be pro-environment, pro in the battle to fight climate change, or be on the other side. We have an election coming up statewide. This issue should be a line in the sand so candidates can decide where they stand on it. And then the voters can decide based on that reaction who they want to support. So I'm excited. I'm proud of it. I'm glad for the work that local jurisdictions like Montgomery County is pursuing on their path. And I think they work together. And look, we might have to come back and make tweaks to this bill next year, the year after, and hopefully, you know, Montgomery County, who's leading the way in many places, can be a laboratory. They can share with the state what works and what doesn't work, so we can refine the bill and make it more aggressive. And I have to tell you in closing, I passed the first climate bill in the state, I guess, in 2009. And at that point, I think only California had a climate goal, and we set 25%. Well, you know, hindsight's 20/20, but clearly it wasn't aggressive enough. We haven't been strong enough and visionary enough to see how serious this problem is. And I think hopefully with Maryland's taking this step forward and jurisdictions like Montgomery County, we can be a model to other states as they look to develop strategies to address climate change. So I want to thank you. I was also asked to mention about education because I chair that committee. And let me also say we had a revenue surplus this year. So we took $800 million of that and put it aside to pay for the back end of the Blueprint for Maryland's Future, also called the Kerwin Commission. So we want to make sure this 10-year phase in to truly reform our schools and make sure every child, no matter what their zip code, gets a good and fair chance and a very successful education. So that'll be paid for, and we'll have the finances at the back end in year 6 through 10. So I think that's also something we can look forward to and maybe rest a little easier, although we have many, many challenges when it comes to schools. While we were hoping for a great phase in of this new law, then we're hit by the COVID, and it really has crushed our kids, our parents, and our teachers, and we're still recovering from that. So hopefully with the assurance of this money in the pipeline, we have a good future ahead. So thank you, Mr. County Executive.
So thank you. And I want to also thank you for the work you did on education. The county certainly has benefited in multiple ways from the session this year, and schools are one place where we definitely made progress. I also want to, just make a comment about your point about helping people transition from work. So I probably would say that it was one of the greatest mistakes that happened nationally was the passage of climate legislation without a thought for how you're going to replace the jobs of the workers who are going to be displaced. So it's all good and well to talk about, we need to shut down coal, which I completely agree with. But when you shut down coal and you leave entire communities without jobs, that's pretty much guaranteed to create an enormous backlash and to convince people that you're really not thinking about the folks who work here. So whether you're in Montgomery County or in Appalachia, decisions we make need to be accompanied by decisions to make sure that we don't harm the innocent bystanders, the workers who go to work every day, and then suddenly find that the things they were doing are no longer things that society can allow to have happen. We've got to be willing to step up and make sure those folks are whole and are retrained to take a place in an economy that emerges afterwards. And I really appreciate your mentioning that, because I think that's a lesson all of us have to take forward as we work on issues like this. There are going to be prices to pay. And as we do the good work, we've got to be willing to do the other work and pay the price sometimes to make sure that everybody comes out of this whole rather than feeling harmed. And so thank you for raising that. I'm going to switch to the COVID part of the update and start with our case rates are now up to 130 cases per 100,000. And that's a 23% increase since that last week. Our test positivity rate has increased to 5.2%, which is a 2 percentage point higher than the state average. And currently 94% of our region's cases are either BA2 or BA 2.121 variants. Our current case rates and positivity are higher than what we saw with Delta last year, but hospitalizations are so far significantly lower. That's not necessarily because the variant is weaker. It has a lot to do with the percentage of our population that actually has a baseline vaccination or got infected. And I think between those who have their vaccinations or got infections, it's an enormous part of our population. But this is also, important to note that we need the folks who've only had the first 2 shots or the first Johnson & Johnson shot to get their booster shots. That the effectiveness of those original shots is going to wane, and they are going to be less effective at preventing severe illness and even worse outcomes as time goes on. I know a lot of people think you got your vaccination, this is just like the flu, you'll come back next year. I want to reiterate that none of the manufacturers is claiming, nor is the CDC, that these vaccines have a durability of 1 year. People are talking about the need to get vaccinated 4 to 5 months after your previous one. I noted that Moderna today talked about releasing a vaccine that's based on the current variant, actually a combination of the current variant and the previous one. But that vaccine is not expected to hit the market until the fall. So if you're out there and you're seeing these cases increase, these cases are going to target people who have the least amount of resistance. And if your vaccine is waning, if you got your first 2 shots and you were 1 and done or 2 and done by last May, it's time for you to think about getting that booster shot again. So please keep yourself safe, keep the people around you safe, and help us, contain the spread of COVID. That's the most important thing that we can do now, is contain the spread of this. We don't want our hospitals filling up again. And speaking of hospitals, we've begun to see increases in patients visiting our ERs with COVID-like symptoms. COVID inpatient counts have risen 56% in the past week. Now, this would normally be a reason for alarm, but it's actually still a very low percentage of county available beds because we had pushed those cases and those inpatients down to very, very low numbers. And when this had all dropped off, Sean can remind me, but I think at some point there were days when we weren't putting anybody in ICU. And so seeing these things begin to creep up again, it's off a very low floor, but 56% is still a substantial increase, and we can't sustain that week after week. So please think about these numbers. Last week, we mentioned that Arlington had moved into the CDC median level. This week, the District of Columbia has moved into this medium level as well. It's evident that the uptick we talked about over the past several weeks is here, and we should be aware of that. And by now, we all know what to do. Wear masks to reduce your exposure, test if you don't feel well, isolate if you test positive, and most importantly, like I said, get a booster. Many of our residents are coming up on their anniversary of being vaccinated. We're still only at 54% of our residents receiving their first additional dose, and some of you are actually eligible for 2 additional doses. It's critical that you all get your vaccines up to date. 54% is much better than the national average if you're in the 54%. If you're in the other 46%, this is not good. And we see nationally how this plays out. We don't need to have this happen here. I'm going to repeat this every time I get in front of you. People do not need to die from this anymore. We have vaccines, we have treatments, we have the ability to control this. We do not need to have more of our residents die if you will just do the few basic things that we're asking you to do. As you can see from this chart, our nation is basically flatlined at about 30% receiving boosters for the past 2 months. This is a recipe for disaster. Being only fully vaccinated at this point is not being completely protected. And I dearly wish the CDC would formally get rid of this notion that people are fully vaccinated, because that might be one of the things psychologically that's holding people back from getting a booster. You can't be fully vaccinated if you need a booster. Those things are an oxymoron. For us to weather further future upticks and surges without mandates, virtual learning, or restrictions, we have to increase our booster numbers. It's that simple. We are trying to avoid all the things that everybody found most difficult about managing COVID. And virtual learning and restrictions on businesses were probably the biggest things that interfered with people's lives and had the greatest impact. We don't need to go there. This week, Salud Bienestar, our Latino health initiative, will be conducting a vaccination clinic at our Up-County Regional Service Center in Germantown. And if you can help us spread the word about this event, it would be greatly appreciated. Another note on COVID, I just want to talk again, as I have before, about long COVID. Vaccinations are important to protecting against severe cases and our healthcare system from being pushed to capacity, like we saw last winter. But it's also clear from all the data, vaccines have reduced infections and transmissions from just catching the virus, which is important due to the ongoing symptom of long COVID. A new University of California, UCLA, research finds that 30% of people treated for COVID-19 developed long COVID. According to the study, patients with a history of hospitalization, diabetes, and higher body mass index were most likely to develop the condition. Surprisingly, demographics that are linked with severe illness and greater risk of death from COVID-19, such as ethnicity, older age, and socioeconomic status, were not associated with COVID-19 syndrome. So this is a real thing. I've directed the HHS to continue to review and analyze all the research and data that's now coming out on long COVID so we can better adapt our understanding and response to handling this condition moving forward. As a county, we do not have the infrastructure or financial resources alone to address these issues. If any of you have read any of the articles about long COVID, it is truly distressing because it's affecting people's hearts. It's affecting brain tissue. This is not something to look at as a minor inconvenience. These could be major inconveniences. They there's evidence that they're not necessarily short-term. So there are warnings about the needs for the healthcare system to be acutely aware of this, because we're not at all prepared for people to suddenly start manifesting signs of illness from something that brews in their body over a period of months or years. So there's a real reason for us to try to keep the cases down. Even if you get a mild case is worse than no case. And the most assured way to keep yourself safe from short-term COVID or long-term COVID is to get yourself vaccinated and stay masks. Yesterday, we changed our policy on requiring masks on ride-on buses. This decision was made following the TSA's suspension of mask mandates, public mask mandates on public transportation that came after a federal judge's ruling on this, that the CDC mask mandate on public transportation was unconstitutional. I'm not pleased that we were forced to make this change, and we did it to provide passengers and operators with consistency with Metro and other regional transportation systems. But let's be blunt. This was a bad ruling by a Trump-appointed judge who has absolutely zero expertise in public health, is imposing their ideology on public health, which is absolutely inappropriate. And they're doing this to overrule our nation's public health expert. This decision undermines potential tools available for public health officials for future surges or future diseases. In short, this ruling is nuts, and it's an absolute intrusion by a judge with no expertise or qualifications in the public health system of this country. And hopefully people will find a way to reverse this. But we should not be subject to this kind of arbitrary rule by people who know nothing that they're talking about. As we join the region and comply with this legal decision, we're going to continue to monitor our transmission rates and our legal options regarding masking. We continue to highly encourage people to wear masks on our buses, as well as in crowded indoor areas. These are the things that helped us contain the spread of COVID. We need to keep doing this, whether it's mandated or not. And as we currently see our COVID rates increase, it is imperative that everyone stays up to date on their vaccinations. Before I turn it over to Sean O'Donnell, I want to thank the council for their collaboration for getting the Police Accountability Board and Administrative Charging Commission legislation passed. This isn't a process that any of us would have wanted to have to follow. The process was made very difficult by the short timelines and the lack of information from the state agency charged with giving us guidance. We sent over to the council something that was the minimalist thing we could manage given the lack of information from the state. We're still missing some pieces, but we were able to put together a really good bill that I think meets everybody's expectations, and it should enable us to meet the state's July 1st deadline. Currently, we only have about a dozen applicants for the Police Accountability Board, and we would like to have more so that nominations reflect the diversity of the county. We're looking for fair-minded residents that believe in procedural justice. This is a really important commission, and if we're going to implement this and get the benefits that we believe we can have from this, we really need to get more residents involved and ask more people to volunteer to increase the pool we have of volunteers. So I'd encourage you, if this is something that you have some passion for and some interest in, we'd like to see your name in the application pool. The PAB and ACC members are compensated. PAB compensation is about $10,000 a year. The ACC members get approximately $16,000 a year. And the chair of the PAB, who also serves on the ACC, receives $22,000 a year. We recognize the amount of work that this is going to involve, and that's why we're attaching pay to it. This is not something that is going to be lightly done, and we anticipate that the load may be, pretty reasonable. Like last week, we were going to this application link in the chat. We're going to put the application link in the chat, and we hope that you all share this as well. And all that said, I'm going to turn it over to Sean to continue on the COVID piece of all this.
All right, thank you, Mr. County Executive. Before we turn it to you, Mr. O'Donnell, for the Pulse report on the COVID-19 update, let's go ahead and open the Q&A portion of with Senator Pinsky, because I believe you do have to go, and some reporters might have questions for you regarding climate change. So with that being said, Daniel Brendel, did you have some questions about climate change?
Yeah, hi, Dan Brendel with the Washington Business Journal. I do, but I don't know that they're for the senator. They're for this county BEPS legislation.
Okay,
we can do that during the regular spot.
Okay, let's do that. So, any questions for the senator from members of the media? Going once?
Well, I think the senator might be able to field this, Lorna. One of the interesting
Steve Bonnell, Bethesda Beat. Go ahead, Steve.
Thank you. One of the interesting things that the council was highlighting before it passed the BEPS bill is the state legislation doesn't explicitly mention preemption, but it's not, and I know the Senate had a carve out that would prevent this from happening that got taken out in the House. Can you provide some light on that, or if you're concerned about that preemption issue between the state and local legislation?
Yeah, thanks for the question. I'm not concerned about it. Virtually all of the legislation we've passed in environment and other areas allows local jurisdictions to exceed it, that our laws are a floor, not a ceiling. So I don't see any reason why a local jurisdiction couldn't exceed what was passed in legislation generally, or specifically on the climate solutions bill. Look, the House changed our bill. They cut out various pieces of language to streamline it. I'm not sure there's any explicit reason for that section coming out. But in my mind, I think what steps the Montgomery County Council and the executive are taking are clearly in line with the step we're taking. So I'm not concerned. I encourage not only Montgomery County, but other counties to do likewise. You know, a number of years ago, I had legislation to require public financing for the state legislature. That didn't pass, but we put in language to allow, to make it clear that locals could do it, and many locals have done that, including Montgomery County, very successfully. So the bill is silent on it. I believe every jurisdiction has the authority to continue, and I think when that section was taken out, along with multiple other sections, it was really a cleanup by the House of Delegates, and there was no implied message.
Do you, the county bill, to my understanding, has more kind of stringent or, higher things than the state bill. I don't know if you can review our local bill, but is there anything that we're doing locally that, might be a model for the state, or, that you would just want to point out in terms of how aggressive it is on building energy performance standards?
Well, I haven't reviewed it, and I sort of follow the view, no investigation, no right to speak. There are lessons and methodologies in the bill. When we relook at our bill next year, the year after, if there are lessons to be taken, we want to follow best practices. And so we'll review it. We're going to be doing it on the state level. We're going to have Department of Environment, Department of Labor, developing a number of strategies. We're going to take a couple years to set up the benchmarking so we have a baseline from which the 20% will be reduced, and a methodology to get there. So look, nothing is ever perfect. And if there are success stories in jurisdictions like Montgomery, we clearly will look at them.
Senator, thank you.
Thank you, Steve. Senator, I believe you need to go.
Okay. Thank you all. Thank you, Ken.
Thank you, Paul.
Thank you. Bye-bye.
Thank you so much for joining us. And we're going to continue with you, Mr. O'Donnell. First, I wanted to say to those of you watching this presentation through County Cable Montgomery, we have a hard stop at 1:25 this afternoon. In case this event runs after 1:25, it will be carried live continuously on Facebook Live and also on the YouTube channel, the county's YouTube channel. Now to you, Mr. O'Donnell. Thank you for your patience.
Of course. Just give me 1 second. I'm going to share our
our PowerPoint presentation with updated information. Okay, you should all be able to see this here. And again, I appreciate our county executive taking you through the very important points with what we're seeing and giving you all the appropriate context. Of course, these numbers and our dashboards do update constantly. So between when we started this briefing and now, I was able to add an additional day's worth of transmission numbers. That number's again risen slightly up to 134. This has been a steady increase over the last several weeks. Our hospitalization numbers have not been, the percentages and new cases have not been updated. I do have a slight update with the most recent numbers reported directly from the hospitals. We are tracking this very closely. What I want to share with you is that we've looked at this a few different ways. And just again, to get context, you see that steady increase that is linked to the BA2 spread in our community. When you look at that with context to the previous Omicron spike, the thing that's very notable is these cases are not increasing anywhere near the rate that previous Omicron spike increased. Looking at this graph, it doesn't look like it's going up very much at all. It is going up. We are having an increasing in cases, increasing positivity. What we also are sharing with you now in the Pulse report is we've been asked to look at if there's a change in demographics of these new cases. And so in the pink bars here, that represents the time from February 21 to March 20th. As you can see from this graph, that was one of our lowest levels of transmission in the county, compared to February 21st to April 17th, where we've seen that increase in cases. You'll see by age group, we are seeing a little bit more activity of the cases in our 35 to 64 range. Obviously, that's a pretty broad age range, but it has gone up from the previous levels. So not really a notable age group that is being disproportionately affected in this rise. Potentially, again, that could be an age group that is traveling, that is more likely to travel or have traveled to places around the world that were having BA2 earlier than where we were, and that might explain why those were going up. Looking at race and ethnicity, again, it's been pretty consistent during this rise with what we saw prior to the rise. So we're saying that we're seeing this affect our populations fairly equally across the board at this time. Again, when you look at that and without looking at the entire peak of Omicron, you can see that our rise in transmission levels, again, this is just from PCR testing, is already well above where we were during the Delta wave. When we look at in the upper left, we look at our transmission rate, as the county executive noted, we're above 5% positivity with PCR tests. Again, this is higher than at any point during that Delta wave. What is notable when you look at the lower right is our hospitalizations. You can see that Delta wave, which is the peak before the large Omicron spike. Those hospitalizations were considerably higher than where we are now. Again, the vaccination levels, the booster levels, are people were just beginning to get boosters midway through the Delta wave. Now we have a significant number of people with boosters, particularly those most at risk, although our booster levels are quite a bit lower with younger populations. And again, we are not predicting anything where the hospitalizations are going, but we are cautiously optimistic that thus far they have been much lower than during similar transmission rates. With just an update from this afternoon, we are at 42 patients who are hospitalized with COVID. Again, this is a notable rise from the previous week, but it's still a very low number in context with previous COVID activity. We know it does trail case increases, but we've been seeing case increases for a few weeks now. We're starting to see some hospitalizations go up. Again, we don't just treat hospitalizations as a metric for COVID activity, and running out of hospital beds is not our only concern in the county. Certainly, we're not concerned about that at this point. But our partners in the healthcare industry do an amazing job of treating patients who come into their care and getting them safely out of the hospital system. Within public health, our job is to try to help the population not go into hospitals. So again, we're trying to keep this rate as low as possible. Sharing again the death rates at the local and state levels. We are still through April seeing a much lower rate than we saw during the previous several months coming out of the first Omicron spike. CDC updated yesterday afternoon their forecast for where we are with the different sublineages of Omicron. Again, we're not surprised at this. The BA2 and the BA2 sublineage, they continue to make up the vast majority of cases. It's even higher, I believe in New York, New Jersey, it's up to 98% of the cases are that grouping. Again, we've been looking at how these waves have been happening globally to inform us and give us some idea of what we might be seeing. We reported last week, we saw some increased case reporting from Mexico and Argentina. This week's update from the WHO, Argentina is still showing some increases. Mexico did have some decreases compared to the previous week, which is encouraging. Across globally, case rates are down globally, which is again encouraging. But obviously, different parts of the world are experiencing these waves at different times. You can see here, again, France and the UK have very similar sorts of COVID activity and waves that we've experienced. We can see that they are on a significant decline now from their BA2 waves. We are hoping ours, again, will move through that. If anything, we may actually be experiencing more of a flattened effect in our BA2. Theirs got to about 50% of their BA1 spikes, and ours are currently trending lower than that. We're hoping we turn it around before we get to that level. Again, we're just reminding folks that there are not only pharmacies that will fill your physician's prescriptions, but there are one-stop test to treat sites throughout the county that does make it easier to receive a therapeutic medication if you're diagnosed as a positive. And then just to update very quickly on where vaccinations are going, we do project that we're around 63% fully vaccinated for the 5 to 11-year-olds. Certainly, all of this has been slow going. This chart here is showing the county-wide vaccinations and additional doses. It does lag by about a week in real time as we wait for the full reports to come out from the state. You can see that those additional doses, those almost entirely second dose boosters, were going up there, but that's about a week old. When you look at the story at our county sites, you can see we're already having some decline in people coming out for second dose boosters. I will say we've had 3 major religious holidays over the last week. We actually did not have county vaccination sites on Sunday as a result, and we know there's lots of people traveling with spring break, so that could contribute a little bit, but we are not seeing a huge activity in people. Some initial people coming out for their second boosters, but as we saw with the previous boosters, people sometimes feel less of an urgency to go immediately after it's authorized, and they try to find a time that's convenient for them. We understand that, and we encourage people to come out and get that booster, particularly if they're in that high risk group, and particularly if they haven't gotten their first booster yet. And finally, just a reminder, we're still handing out masks and rapid test kits at our libraries. There are 5 rec centers and the Dennis Avenue Health Center that also have the take-home self-administered PCR test that you register online and then drop off in one of our drop boxes. We are just reminding folks that those are very helpful if you need a PCR result for traveling, or if you learn that you were exposed to someone who had COVID and you don't have symptoms yourself. Those PCR tests are a little more sensitive. We ask that people pick those up when they need them rather than store them at home. Whereas the rapid test kits are really useful if somebody in your household suddenly starts experiencing symptoms. You have the test right there 15 minutes later. The sensitivity for identifying COVID in somebody who's symptomatic is very high. So we're trying to make sure people understand the utility of both of these types of tests. And again, as our county executive mentioned, we're very pleased that our partners at Saluti Bienestar, at Suburban Hospital, and the director at Up County Regional Service Center are hosting a big COVID vaccination event up at the Up County parking lot. And it's a great chance, if you haven't gone out to get your booster yet, to go and get it there. Lots of other sites available through our website if you're looking for a place to get a vaccination. At this time, that's all the updates I have. I don't know if there are any other updates from our county team. If not, we're happy to take questions.
Thank you, Mr. O'Donnell. And with that, let's go ahead and take the questions. I believe Dan Brindell, Washington Business Journal, you're up first. Good afternoon. Dan, you still here? All right, then let's move forward with Steve Bonnell, but that's the beat. Good afternoon again, Steve.
Afternoon. The county executive's made his opinion clear on the mask mandate ending on ride-on. I'm just wondering if there's going to be any possibility, if cases rise, worst case scenario between now and early May, about the county reinstating it kind of unilaterally. I know some other jurisdictions have decided to do that on subways. I think New York City is one of them. I'm just curious what the county thinks about that. And I guess that's for anyone who wants to field that. I think you're muted, Mark.
Took a couple of clicks to get that done. Sorry. If cases go up and it's problematic, I have no qualms at all about reinstating mask mandates. I thought they were the safest thing, most common sense thing we can do. And I still see a lot of residents continuing to wear masks when they go out. I think it's important. And I would hope that since people, seem to adjust to it pretty well, that if we have to do this again in order to tamp the spread down, that people will be willing to go along with it. Like I said, this county and its residents have been pretty remarkable going through this so far. I know there was a poll out, not the county poll, but a larger poll that talks about residents in general, people in general being willing to support mask mandates. It is the least intrusive, most common sense thing we can do. We shouldn't hesitate to do it if we need to.
To be clear, would you start on transit and then go to other settings? Or are you saying you would do more than just transit?
Look, if it's really spreading, then if you're not going to put capacity limits, for example, in crowded stores or crowded buildings, then you need to at least put the mask mandate on. Masks do make a difference in the spread of the virus. I think before we get to drastic things like limiting hours or limiting capacity, the first thing to do is just to put the masks on and see what that does to transmission rates. I'd start there.
Right. And I guess, with the new CDC metrics, low, medium, high, and maybe Sean can pitch in here too, or anyone else who might be on this call, but is there a number? I'm guessing there isn't a number in terms of when that decision would be made. I know last fall, the mask mandate was tied to this metric, as I reported. I'm just curious, if cases go up, is there a target you're looking at, or is it, I guess, does it depend? I guess that's all I'm looking at in terms of clarity there, if that makes sense.
Yeah, Steve, I was going to say, this is a good example of where the virus and the community protection through immunity is coming into play. The virus, the evolution of the virus, and the rate of current immunity, either from the previous threat or from boosters, is helping us understand what the real threat is. And right now, again, our decision-making is being influenced by the fact that we're seeing limited serious illness so far. If we saw that go up, that would be a contributing factor to us, to public health making a recommendation that we have greater concern about the spread. Again, we're seeing the transmission go up quite a bit faster compared to the serious illness right now. So we're balancing both of these things. Again, we didn't go into details about some of our other surveillance metrics, but we are informing our leadership on these. We are tracking outbreaks in assisted living and nursing homes, where some of our most vulnerable populations are. We're tracking numbers with MCPS. They updated us yesterday on the results of testing following spring break and their action measures. So we do have good information about these other places, which are congregate settings and where we would have greater concern. And again, some of these settings are shelters, are assisted living and nursing homes. There are mask mandates in those because, these are not discretionary about people being in these settings. They're, they have to exist and we have to have them. And so there are mask mandates for a reason in those settings. You could argue public transportation is again, an essential congregate setting. But right now, again, we're not seeing the serious illness. The populations who are on that don't necessarily represent the sensitivity of say, our assisted living facilities.
Thanks. This next question's similar to what I asked Senator Pinsky about the BEPS bill. And I think the county executive, Ray Gianna, if either of you could field this. It's my understanding that obviously the county's bill is stronger from the sense of being more aggressive in terms of the state requires of buildings versus the state bill. I'm just wondering if there's anything the county executive, Ray Gianna, wanted to highlight in the difference between what the state just passed and what the council just passed yesterday.
Adriana, do you want to talk about it?
Sure. So one difference is that in the county's bill, the buildings that are covered are 25,000 square feet and larger. I believe that in the state bill, it's a smaller subset of buildings, 35,000 square feet and larger.
And that's very helpful. Is there anything else you want to highlight, or is that the main thing?
That would be the main thing right now. With both of these sets of legislations having been passed, the details are going to be worked out through the regulatory process. So we intend to be working very closely with the state officials who will be developing the regulations to fully understand the state regulations and how they will compare with our county regulations.
Can you speak to that process briefly, if you can? I heard yesterday that this is where the rubber meets the road and that it's really complex policy.
The BEPS law that passed yesterday sets out a timeline by when the county regulations need to be enacted by December 31st, 2023. And so we intend to have a very public process, transparent process by which the regulations will be developed. And at the state level as well, I understand that there will be a task force established, including with various stakeholders to develop those regulations at the state level.
Thank you, everyone.
Thanks, Steve. Kate Ryan, WTOP, you're next. Good afternoon, Kate.
Thank you very much, and good afternoon, everyone. Mr. O'Donnell, specifically because you mentioned MCPS and the testing that parents were asked to do on the 18th before kids return to school. Do you have those results? You know how, I think you the slide indicated 490,000 tests were distributed to MCPS, correct? You're muted.
Yes.
Yes. What did you find? What are the findings?
Over time, and I know they've been procuring additional tests. I know that before spring break, they distributed out rapid tests, a new round of rapid tests to all of the students and the staff, and they asked them to report their tests, to test themselves and report them Monday. What they've shared with us is that they have, I believe they've identified through that process, through the reporting process. So it could be people who went to other testing places too, but 631 active cases over the last 5 days. And so in context, when they returned from winter break, there were more than 6,000 cases that were identified. So this is certainly a very different place that they're in. Now they're tracking what schools they're in. Many of those cases are siblings, and so it's not surprising that there's multiple people in a family who are positive. And the key to this is these are students and some faculty who were tested positive and did not come back into the school because they know they're positive. Additionally, yesterday, my colleagues in school health services had 63 symptomatic students report to health rooms, which is not a particularly high number across the entire school system. Of those 63, only 3 of them tested positive on rapid test. So again, we're not seeing a huge number of cases. We're not surprised at finding, with a 5% PCR test positivity rate. We're not surprised that they found a good number of cases across the schools, but in the context of their total population of students and faculty, that's not high. Additionally, they are resuming their in-school PCR testing that they do that helps them get a measure of the asymptomatic possible COVID activity going on, and those schools where they find a significant increases in positivity, they have a number of disease control measures that they're working on, which includes, and they have been doing this, includes in some cases school by school or class by class masking requirements. If they have a number of students who were positive in that class, they may have the class go to mask for a temporary period of time. They may also do some repeat testing a week out, like we do with other outbreak settings if there's enough cases. So they are sharing all of these measures that they're doing, and we're in consultation with them daily on what's going on.
Got it. And I know we're a little bit over, but I do want to follow up with you on, you said 631 active cases. Do we know, are these mostly families who traveled or get-togethers, or do we have any kind of hint as to?
Yeah, I don't think, I don't have that detail, and I can follow up with our colleagues, but I don't know if the reporting mechanism really went into that deep of a dive to understand it.
And I know our time is tight, and I want to get to the county executive very quickly. Mr. County Executive, in Prince George's County, the masks have remained and do remain on kids in schools. The indication is that's kind of till further notice. Do you think, A, that Montgomery County should have stuck with something like that in our school system? And B, I hate to ask you again, but where are we on the health officer appointment?
We're waiting for their meeting, I think, which is this week with the head of the department. So we've been in limbo. I think that's correct, Sean, right? It's this week their meeting?
I believe that may be the case.
So we're waiting for this to be blessed. I never thought, I've always been comfortable with mask mandates. I've always thought they were kind of a minimalist approach to making sure that we could protect people, always. So that's kind of been my approach to this, and it's going to continue to be my approach to this. And the school system looks at their situation, is going to make a decision. This is, we do not have the authority to impose a decision on them. I hope they, do think about all this stuff as we go on. So I'm okay where we are, but I do think that it's, I think it is the least intrusive, safest way to guarantee that everything stays open and we don't have to regress.
Got it. Now, I know Lorna always has her eyes on the clock, and I appreciate that too. One quick follow-up on the PAB, ACC applicants. Do you have applicants' names? Have people already submitted names? I know that
we've got 12. We've got 12 people so far that I know of as of yesterday.
Okay, and the process has to be wrapped up. I know according to the bill and what people say, by July 1st, they'll be ready to hear some cases, depending on who's in collective bargaining. Can you meet that deadline?
We're supposed to meet that deadline, and that's what we're trying to do. I mean, the state's made this really, really difficult because to the extent they haven't provided final guidance on a couple of things, we are aware, for example, that we could be interviewing people who ultimately may not be eligible under the state guidelines. So it would be really nice if they'd actually facilitate our doing our job. They're supposed to be doing this. I don't see them doing what they should be doing.
And when you say the state, are you talking about the?
There's a state agency that oversees this. They're supposed to, provide direction or guidance or whatever their limits were. And I'm just not, we're still waiting. Maybe it changed yesterday, but we were still waiting.
All right. Thank you very, very much. Thank you, Lorna.
Thanks to you, Kate. I do not see any more questions coming from members of the media. Going once, going twice. All right, I guess we're done for today. Thank you, everybody, for joining us. Thank you to the guest, and we'll see you again sometime next week. Thank you, everybody. Have a safe afternoon. Bye-bye.
Thank you. Bye, everybody.
Thanks.